increases your experience and experience decreases your mistakes. If you learn from your mistakes, then others learn from your success. Hi everyone. Up till now, we have discussed the role of countercurrent multiplier in the generation of medullary hyperosmolar environment. Now, today we will be talking about the countercurrent exchanger. Now, a curious mind will think that when the medulla is very hyperosmotic and there is a lot of solute which are concentrated in the medullary interstitium, why these solutes are not washed away? And what about the nutrient supply to the medulla itself? Because if there is a circulation of blood in the medulla, these salts would ultimately be washed out. So, there are special mechanisms which are developed in the kidneys which tries to preserve the nutrient supply to the medulla as well as tries to preserve the hyperosmolar environment in the medulla. So, talking about the first special feature of the renal medulla is its very low blood supply. So with a supply which is less than 5% of the total renal blood flow, medulla is supplied with a very sluggish blood flow. And because of this sluggish blood flow, the solutes are not washed away and they remain in the medullary interstitium, thus trying to preserve the high degree of interstitial osmolarity of somewhere around 1400 milliosmoles. So, first point to remember is the low blood flow in the renal medulla. The second feature and a very important feature of the medullary interstitium is the presence of capillaries which are known as the vasa recta. And these vasa recta tries to preserve the medullary hyperosmolar environment. Vasorecta are peritubular capillary network which surrounds the juxtamedullary nephron, and they try to maintain the hyperosmolar environment and behaves as countercurrent exchangers. To understand this, we can assume a situation, a hypothetical situation, if the vasorecta was straight tubes. Now we know that vasorecta are some U-tube structures which are surrounding the loop of Henle. But assuming a situation when the vasorecta supposedly were straight tubes, what would happen? They would go deep into the medulla, starting from the cortex, they would go deep into the medulla, and we all know that medulla is very hyperosmolar. The osmolarity in the medulla is very high. So as a result of which, as the vasorecta will move deep into the medulla, the solute would perfuse into the vasorecta because of a high degree of osmolarity in the medulla tissue, and as a result of which finally these solutes would have been washed away out as the vasorecta would leave out of the medulla. But this hypothetical situation is not actually present because vasorecta are shaped tubes which are surrounding the loop of Henle and they are present in the medullary interstitium. So what happens? These vasorecta are receiving blood, and the osmolarity of blood when it enters the medulla is somewhere around 300 milliosmoles, because this is the blood which is entering here from the efferent arteriole. Efferent arteriole is continuing as the vasorecta and juxtamedullary nephrons. So when the blood is entering into the medulla, the osmolarity is somewhere around 300 milliosmoles. As the blood descends into the vasorecta down, it is encountered with the high osmolarity of the medullary interstitium, as a result of which the solutes diffuses inside the vasorecta, and there is continuous diffusion of solutes inside, because we all know that medulla keeps on becoming hyperosmolar as we descend down. On the other hand, there is continuous movement of water out of the vasorecta because of the increased permeability of the vasorecta to solutes as well as to water. So by the time the Vasorecta reaches deep into the medulla, it has collected too much of solutes inside the blood, and the osmolarity rises to a high level, somewhere around 750 milliosmoles. As the vasa recta is not a straight tube, if it were a straight tube, this would have led to the loss of solute. But the vasa recta turns up to form the ascending limb of the vasa recta, and in this situation, when the vasa recta is turning up, the solute now moves out from the lumen of the vasa recta into the surrounding medullary interstitium because of the decreasing osmolar pattern as the capillary is rising up towards the cortex. So medulla is very hyperosmolar, deep in inner medulla is very hyperosmolar, and as the capillaries are moving out of the deep inner medulla towards the cortex, the osmolarity is gradually decreasing, and because of the decrease in the osmolarity, what is occurring? The solute will move out. The solute is moving out, and there is a movement of water into the vasa recta. So finally what happens? Solute moves out and the water moves in, ultimately reducing the osmolarity of the blood finally to somewhere around 450 milliosmol as it is moving out of the cortex. So that means that this special arrangement of the vasa recta in form of a U-shaped tube prevents any loss of the solute, and as the solute moves up in the ascending limb, it is again reloaded back into the medullary interstitium, and there is prevention of the loss of the medullary hyperosmolar environment. So by circulation of the solute between the ascending and the descending limb of the loop of Henle, and these solutes are sodium chloride as well as urea, there is preservance of the medullary hyperosmolar environment and the solutes are not lost away. And this countercurrent mechanism is operating as a passive process. It is not an active mechanism. It is operating as a passive process, and it is trapping the solutes into the medulla and preventing loss of any osmolar gradient. So I hope this small topic of countercurrent exchanger is clear to you. Thank you.